My name is Mumo Mwoki. I'm a clinical oncologist at Texas Cancer Center. At Texas Cancer Center, we offer varieties of treatment options. But before that, we also do screening for the unconfirmed cases of cancer. So in case it's a new patient with no confirmed cancer case, they can come for screening at Texas Cancer Center. We offer screening services like prostate cancer screening for men above 40 years of age. We also do breast cancer screening. We also do cervical cancer screening into our facility. And in case a patient comes with an already confirmed case of malignancy, we offer various treatment options, including chemotherapy. We also offer radiotherapy. We also offer immunotherapy. We also do offer brachytherapy for special cancers, including cervical cancer and also cancer of the vulva. Basically, when a patient arrives at Texas Cancer Center with a confirmed cancer case, the first thing that we do is we offer counseling, because we understand the magnitude of this condition is not something easy. So we try to engage our patients. We counsel them about the treatment options and the possible outcomes. So one of the main challenges that we usually face at Texas Cancer Center and generally in Kenya when it comes to cancer management is that most of our patients, they usually present with an advanced disease. Around 70% of the patients that we see usually present with either stage 3 or a stage 4 disease. And in those instances, we have limited treatment options for them. And also the outcomes are not quite favorable. One thing that we can do to mitigate this challenge of late diagnosis is, for the society, we need to encourage early screening of cancer. Most of these cancers can be diagnosed at very early stage, and once cancer is diagnosed at a very early stage, the treatment options are quite advanced. And also the outcomes, they are very, very good. We have very many treatment options in case cancer is diagnosed at stage 1 or stage 2. And also the outcomes from the treatment usually quite good. But the main challenge that we face is that most of the patients, they usually arrive at the hospital at an advanced stage. So it's high time that we encourage people outside there to undergo regular screening. Of course, not all cancers can be screened, but the few cancers that can be screened, we highly encourage people to undergo screening. Another challenge that we face is that people outside there have a lot of misconceptions and some kind of stereotypes about cancer. There is a lot of effort that needs to be put to ensure that we do a lot of awareness and education to the society outside there for them to understand what is cancer, to be able to know what are the signs and symptoms of cancer, so that at any instance a person suspects something, they can go to the hospital immediately. Some will say it's a curse, some will say it's something, genetic, or something I inherited from someone. Yes, cancer has some genetic lineage, but not all cancers have genetic lineage. So it's always good for the society outside there to be aware of what is cancer, what are some of the signs and symptoms of this cancer, and for them to understand that cancer can be treated, and that early diagnosis is the key in terms of fighting this monster called cancer.
You talked about screening.
Yes.
I know most of people wondering, how is this screening done?
So Ideally, what is screening? Now, screening is the act of checking a healthy individual or someone with no history of cancer, just to check whether they could be having any potential elements of cancer within their bodies. So you check a very healthy individual with no active cancer, or someone who is not on active treatment. So we just check on them to check whether they could be having any features or signs or symptoms or any traces of cancerous cells within their body. So most of the time, we usually, for men, we do prostate cancer screening. So for prostate cancer screening, we do what we call the PSA test. So the PSA test is just a blood test that we usually take from the men, and then we run it in the lab to see whether the levels are within the normal ranges or they are elevated. And then for the breast cancer, it's one of the most cancers in women and also men. You should take note of that. It's also common in men, not just for women. So for breast cancer, we do, number one, we do what we call clinical breast examination, where we examine the breast bilaterally. We check at the two breasts. We check at the nipples. Are they retracted? Are they in their normal position? We check whether we palpate to see whether there could be any palpable masses within those breasts. We also check at the symmetrical appearance. You may notice some, maybe one breast is larger than the other one. We need to have a look at it. We also look at the symmetrical appearances of the breast. We check whether both breasts are in normal sizes. In case one is larger than the other one, we may need to do further examination. We also, for the ladies below 35 years of age, we do what we call breast ultrasound, just to look at the breast tissues to see whether there could be any lesions within or any small masses within the breast. For ladies above 35 years of age, we usually do mammograms. The other one that we do is cervical cancer screening. Now, cervical cancer screening is also a very, very common cancer among the women. What we do basically here, we do the pap smear, where we do what we call the via and the villi. Basically, we just try to look at the cervix. We take a sample from the cervical, from the cervix, and then we take it to the lab for further examination to be able to see whether we can see any precancerous lesions or any precancerous cells within the cervix. Yes, but ideally not all cancers are screenable, but those are basically some of the cancers that we do screening more frequently. One thing, the message will always remain one. Early screening is the key to combat this monster called cancer. If cancer can be screened and diagnosed at early stages, cancer can be treated. And so we encourage people all over, to our viewers and those who are watching us from all over the world, that they need to get screened as early as possible. Kujijua ni kujipanga, that's what we say. Once you know yourself, you start treatment as early as possible. Cancer is treatable, and cancer is well managed when diagnosed at a very early stage.